Again, I'm Vikin Karagosian, CEO and President of Allegro Ophthalmics. We've presented at OIS many times. This is our first time for Allegro presenting at ASCRS because we're introducing a new drug candidate for dry eye disease. So Allegro is a private ophthalmic company. We have extensive experience in ophthalmic drug development, about 125 years collectively between the group. Rezutiginib, or Luminate, as it's known, is our lead candidate in retina, and we have late-stage programs in diabetic macular edema and a study that's just about finishing up in dry macular degeneration. What I wanted to introduce everyone to today, on the other hand, is a new platform compound, ALG 1007. It's also an anti-integrin compound. It's a topical eye drop for dry eye disease. Here's our pipeline. Again, rezutiginib, or Luminate, has 3 programs underway, DME and late-stage studies, dry macular degeneration reading out very shortly in the next month or two, and ALG 1007, which we're going to introduce today, we're very excited about, in dry eye disease as a topical compound. All of these compounds come from anti-integrin peptides. Early preclinical work suggested that it was worthwhile pursuing these anti-integrin peptides in dry eye disease because they have robust anti-inflammatory effects, both on leukocyte attachment and leukocyte migration, as well as on the complement 3 pathways themselves. Again, ALG 1007, this new pipeline drug candidate, is a topical eye drop. It's in a hyaluronic acid base. The targets, one of the main targets includes alpha M beta 2 integrin, which gives you robust anti-inflammatory effects on leukocyte adhesion, leukocyte migration, and the complement 3 pathways. We were very happy to see that the early preclinical work also translated into animal work as well, and you can see very clearly here that just even from far away that the cornea and the conjunctiva, you can normalize it very significantly, even in very, very dry conditions, whether you chemically dry the cornea or you put it in a dry environment like a desiccating chamber, or both. What's also interesting is when you follow the inflammatory markers, you get a very broad downregulation and robust downregulation of multiple inflammatory pathways that plays along nice with what you'd expect. We've already finished our first ex-US human proof of concept study, and that data is going to be presented here by Dr. Donenfeld on Monday afternoon. We'll give you a little teaser of it today. This first ex-US human proof of concept study was an open-label 40-patient study looking at 4 different concentrations of ALG 1007 ranging from 0.125% to 0.6%. The inclusion criteria was that the patients had to have dry eye disease for at least 6 months, and then had to have certain criteria where they either had a tear breakup time qualification or a dryness score qualification. And then you had the typical signs and symptoms as your endpoints, with everything from conjunctival staining, corneal staining, total ocular staining, tear breakup time, and then also the symptomatology as well. And of course, as our first human study for this ALG 1007 compound, you want to look at safety as well, which has been excellent. Without giving anyone too much information, we'll show one slide here. For nasal conjunctival staining, one of the endpoints that we had predefined, you can see you get a very robust response in this 40-patient study, which is statistically significant and also gives you a nice dose-response curve as well. There were no AEs, and also from a practical standpoint, you're not getting any blurring or foreign body sensation or irritation when you put this in. So you can see well within a minute or two of putting the eye drop in. What's also nice is, as I said, Dr. Donenfeld is going to present the full data set on Monday afternoon at 1:45 in a few days from now. We saw a robust response across nearly all of the endpoints, both the objective and subjective endpoints that you'd use for phase 2 and phase 3 studies. Along those lines, we've already started a second ex-US phase 2 study. This study is already fully enrolled. It's 64 patients. Looking at, this time it's a double-masked placebo-controlled study. This study is looking at even higher concentration, starting at the best dose from the prior study I showed you at 0.6 milligrams. of ALG 1007, and then going up to 0.8 and 1.2 milligrams as well. The outcomes of the study are very comparable to what you'd see in other, the first study that we did, as well as studies that are coming up, the typical signs and symptoms of dry eye disease as well. We expect this study to be completed and the results to be released by the second half of this year and presented at AAO. Along these lines, with all the front of the eye work that we've been doing, we've also been very fortunate to put a world-class scientific advisory board together for the front of the eye, including Dr. Donenfeld, Dr. Holland, and Dr. Lindstrom. And they've helped us guide our programs going forward. In summary, Allegro is focused on our anti-integrin portfolio for both front of the eye and back of the eye diseases. Rezuteg and iberluminate is in late-stage studies in diabetic macular edema and soon to be read out dry macular degeneration. And we'll have phase 2 studies from our dry eye disease presented by Dr. Donenfeld on Monday. Thank you.